Number 1. COVID-19 is a coronavirus, which means very little to most people who don't work in virology or immunology. A coronavirus is a group of viruses that can infect mammals and birds. In humans, they can cause respiratory tract infections, many of which can be treated with over-the-counter medication. The so-called common cold is the result of a coronavirus, and while most are well understood and rarely more than an inconvenience, some can be lethal. COVID-19 refers to the outbreak of the disease, which is broken down as coronavirus disease 2019. The virus itself also has a name, but it's a bit of a mouthful: severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2. Part of that acronym may be familiar, seeing as the world already went through a similar outbreak of SARS in 2003. The viruses are related, and it wouldn't be out of the question to call this new outbreak SARS 2.0, though you likely won't hear any professional virologists say that in the media. Regardless, COVID-19 is a coronavirus, and it is spreading, but that's not a cause for alarm. Rather, it's a cause to prepare and protect ourselves in much the same way we do when it's cold and flu season. Number 2. Since the first day the world learned about the Wuhan coronavirus, the fear of it spreading began to rise. How was it transmitted, and what could be done to limit its transmission? People have always feared Ebola, but that's far harder to catch than something like a coronavirus, and it's all about what it infects and how it is transmitted. COVID-19 causes a respiratory infection, and it's through a person's respiration that it spreads the easiest. There are two known means by which the virus spreads: person to person and through contact with infected surfaces. In a person-to-person situation, the virus can be spread through close contact, which is generally considered to be a distance of 6 feet. The way a person can pass it on is through respiratory droplets, which are produced when a person coughs or sneezes. Covering one's mouth when this happens helps alleviate the spread of the disease, and infected people should wear a face mask to reduce the risk of transmitting it to someone else. But please heed the Surgeon General's warning and don't buy a mask unless you need one. Number 3. One of the biggest issues with detecting COVID-19 in a patient is that it presents much like the common cold. To combat this, researchers across the globe have been scrambling to come up with a way to test for the presence of the virus, and this has resulted in several different testing methods. One of the best ways to check for the virus isn't to see if you can find the virus in a person's body, it's to find the antibodies the body produces to fight the infection. The tests that look for antibodies are called serological tests, and a firm in Singapore may have perfected a means of conducting this type of test to find COVID-19. Antibody tests are probably the fastest and easiest way of detecting the presence of COVID-19, but it isn't the only way. There are tests currently being used around the world, which look for the virus genetic information in a person's saliva, mouth, nose, and anus. These tests use the polymerase chain reaction (PCR) method, which is a process in molecular biology that rapidly produces billions of copies of DNA for study. While these tests can detect the presence of COVID-19, they cannot identify people who were infected and ultimately cleared of it. Number 4. The first part of this block is going to list the symptoms associated with COVID-19 that shouldn't scare anyone, but the last bit will be all about the more dangerous aspects of the disease. Don't be alarmed, as these are the worst-case symptoms that won't affect most people who are infected. The most common symptoms of COVID-19 are fever, coughing, and shortness of breath. These are the same symptoms most people get from the common cold, but they are the mildest possible symptoms a person can experience. For those who are under a greater deal of risk due to a compromised immune system, or meet the criteria previously mentioned, symptoms can become far more severe. COVID-19 can increase the chances of contracting pneumonia, it can cause multiple organ failure, and in some cases, it can result in death. These are the most severe cases, though all are of concern due to the ease by which it can be transmitted from person to person. Number 5. What to do if you think you're reinfected with COVID-19. The very first thing you need to do is remember the words printed on the cover of The Hitchhiker's Guide to the Galaxy, which are "Don't panic. Panicking doesn't help you or your loved ones, so you need to take care of yourself to ensure you don't spread the infection and make sure you get the proper care. If you develop a fever along with symptoms of respiratory illness, you should call your healthcare provider and ask for their advice. They will know the right questions to ask to help determine if you've got the common cold, or if you have something more serious. If you fear you truly did come in contact with someone infected with COVID-19 and are concerned you may have it as well, you need to get tested. Because you are leaving the house to get checked, be responsible, and keep your mouth and nose covered. This will keep you from passing the virus to other people. So if you have a respirator or a surgical mask you can use, do so. If not, you can use a scarf or similar article of clothing. Your local hospital may not yet be equipped with testing kits for COVID-19, so call your local public health department for information on the best place to go.